Heart disease is the number one killer in India. The number of cardiac interventions has been rising year after year. Complex heart operations in India are being performed in world class centers by world class surgeons. It is estimated that more than 250,000 heart operations are delivered through nearly 450 cardiac surgical centers in India. Despite large volumes and growing demands in cardiac surgery, evidence suggests that the hospitals in India, like the rest of the world, have significant inter-hospital mortality variation. For example, the mortality for coronary artery bypass graft surgery is reported to be 0.86% in one center and 6.6% in another center within India. The most significant factor that contributes to this inter-hospital mortality variation is failure to rescue. In cardiac surgery, failure to rescue most frequently occurs in the post-operative period on the intensive care unit. Many attempts have been made over the years to reduce failure to rescue and improve outcomes after cardiac surgery. A key development in this area is the CALS, that is a cardiac surgery advanced life support. CALS is the new and proven protocol to resuscitate patients in cardiac surgical arrest. The protocol is endorsed by the international professional bodies, including the Society of Thoracic Surgeons of America, European Association of Cardiothoracic Surgeons, European Resuscitation Council, and International Liaison Committee on Resuscitation. CALS is shown to improve the quality of cardiac arrest resuscitation in cardiac surgical patients. Studies have shown that the implementation of CALS guidelines has improved the outcomes by up to 85% following cardiac arrest in post-cardiac surgery. So what do? CALS is taught in two formats. One is a provider course for all the staff members, including doctors, nurses, perfusionists, theatre and ICU staffs who work in cardiac surgical units. And there is also a train the trainer course for those staff members who want to become a part of CALS teaching faculty. These one-day courses teach the staff members the CALS protocol, 5-point action plan, and a 6-role team approach in the event of resuscitation. There is a e-learning module provided to the participants prior to the course. A course manual on CALS is also given to the candidates. A custom-built 4th generation 3D generated mannequin is used for the purpose of training, along with a 5-piece restonotomy kit to teach reopening of chest within 5 minutes of cardiac arrest. The course includes didactic lectures, simulations, case scenarios, skill stations, and human factors. At the end of the course, all participants will receive an international certificate with a unique international ID that is issued centrally by the CALS UK. In 2018, CALS faculty from the UK toured around various centers in India. The response was overwhelmingly positive. We have taken the feedback from the professionals and tailored to local requirements for India. We are pleased to note that the first set of courses are commencing in March 2019 at Sri Ramachandra Institute of Higher Education and Research in Chennai. We anticipate more hospitals to sign up for centers of excellence in the near future to promote CALS training across India. The motto of CALS India is to save lives through education. We ask the clinical teams in the cardiac surgical centers in India to learn, practice, and get certified in CALS in line with international recommendations.